what we learn about Saurabh and his whole journey into the diagnosis of the disease he suffered from is, I would say, a typical story that we hear from most of our patients who are suffering from this disease. The doctor who was really, trying to diagnose his illness felt that maybe Saurabh did not have tuberculosis at the very outset and gave him a course of antibiotics. Now that is quite, again, very common because symptomatic management is the first really the response of the medical profession to any patient who is coming to them. Sputum was ignored. It should not have been, because sputum would tell us how much of the lung disease the person is having. On the basis of chest X-ray itself, you may get pleural effusion, but that does not mean that there is no underlying lung disease. So one has to do the sputum and also do the susceptibility test within the sputum to understand whether the organism which is causing the disease in Saurabh, that will respond to the drugs which we have for treatment. So I would say that sputum examination and chest X-ray, that's the guideline for treatment. And subsequently do universal DST is now the norm. Every individual suffering from TB is required to really understand the drugs which will kill the bacteria. And if it is drug resistant, the treatment entirely is different. In Saurabh's case, we learned he had XDR TB. That means his organism was resistant to the most potent first-line drugs, which is rifampicin and isoniazid, and the most potent second-line drugs also, which are the quinolones and the injectables. In the presence of this scenario, the options available for Saurabh in the present-day context are very clear. A patient who is XDR has to be given the newer drugs. All of us have to join hands in order to defeat this particular disease. Said TB हारेगा, देश जीतेगा, पर TB तभी हारेगा अगर हम सब एक साथ मिलके इस लड़ाई को जीतेंगे.